Welcome to this explainer. When we're dealing with anti-neoplastic or chemotherapy protocols, the details are absolutely everything. Safe handling and proper administration, they aren't just like guidelines in some dusty manual. They are literally the lifeline for the patient sitting right there in the chair. Today, we're taking a super focused look at how one specific, incredibly precise clinical warning about an IV medication can just alter everything we know about a treatment plan. Because honestly, in the world of oncology nursing and pharmacology, a single sentence can literally mean the difference between healing and severe harm.
But here's the thing. Hidden within these massive, dense mountains of medical documentation lies a critical warning about peripheral administration. We're intentionally pulling out and isolating this one singular, essential fact today, mostly because extracting these specific risks is really the cornerstone of effective nursing management and ultimately patient safety. It is terrifyingly easy for one vital sentence to just get swallowed up in a sea of complex guidelines, drug monographs, and safety checklists. But finding that sentence and truly grasping its implications, well, that changes absolutely everything about patient care.
Just consider the reality of what clinical staff are actually looking at on a daily basis. Within all these faded lines, the extensive charts, and those incredibly dense paragraphs detailing anti-neoplastic handling, critical warnings can sometimes be completely, utterly buried. Picture the high-pressure environment of an oncology ward. Nurses are balancing multiple patients and administering highly toxic medications. So navigating this paperwork, it's essentially a high-stakes scavenger hunt. Finding a procedural hazard isn't just some academic exercise, it's a vital, non-negotiable step in ensuring a patient's safety during their absolute most vulnerable moments.
And this challenge just multiplies as you keep reading. Imagine flipping through pages upon pages of drug monographs, dosing schedules, and complex side effect management charts. Visual fatigue is a very real, very dangerous thing in clinical settings. When you're reading your 50th chart of the week, the words can definitely start to blur together. Yet, buried right in the middle of all this unassuming documentation is a crucial procedural hazard. This specific hazard dictates exactly how a powerful chemotherapy medication must, or actually more importantly, must not be administered to the patient.
So here is the exact phrase we were looking for, totally isolated from all that background noise. 1 thrombophlebitis with administration through peripheral vein. There is absolutely no ambiguity here. The text explicitly flags thrombophlebitis. And to be totally clear, that's a very painful condition, where a blood clot causes severe inflammation in the vein. It ties that condition directly to the route of access. We aren't just talking about a mild irritation or a little redness. We're talking about a major complication that can completely halt chemotherapy and cause immense pain.
This brilliantly illustrates the direct cause and effect relationship that clinical staff literally must be hyper-aware of. Taking the standard, seemingly simple action of using a peripheral IV for certain anti-neoplastic medications is a direct pathway to a severe, painful inflammatory complication. It's a linear risk. Action A leads to bad outcome B, and that demands immediate nursing intervention and really proactive side effect management. You can't just follow standard procedure blindly, right? You have to know exactly when the standard procedure is actually the trigger for a major adverse event.
The crucial takeaway here is that this isolated, dangerous outcome stems directly from standard administrative text. Meticulous, line-by-line review is just paramount because, with anti-neoplastic agents, you simply cannot skim. You just can't. A single missed line doesn't just mean a protocol violation on paper. It bridges the gap directly to serious patient harm. It emphasizes exactly why safe handling protocols are so rigorously enforced and why nursing staff must be empowered to question and verify access routes before a single drop of medication is ever administered. As we wrap up this explainer, I really want to leave you with this final thought. How does documenting this single risk alter standard peripheral administration protocols? Think about it. Recognizing this hazard shouldn't just be a memorized fact for a test. It has to actively change everyday clinical vigilance. It dictates how a nursing team manages side effects, maybe even prompting them to advocate for central line access much sooner just to protect the patient's vascular health during chemo. Thanks so much for joining me on this Focus Deep Dive today. Keep asking questions, always read the fine print, and I'll catch you in the next explainer.